Hello, my name's Dr. Sandra Cabot. I'm a medical doctor with a special interest in the liver. Today we're going to talk about chronic viral infections of the liver, such as hepatitis C virus, hepatitis B virus. These infections are very, very common today, and it's very important for people to have a healthy diet and lifestyle if they're going to reduce their risk of scarring of the liver. And here in Phoenix, Christine Key, my naturopath, hi Christine.
Hi Dr. Cabot.
Gets a lot of calls from people who are confused about the best diet, the best juices to help improve their liver function, to maintain a healthy liver for the rest of their life, even if they do have a chronic viral infection. So Christine, what are some of the common questions you get asked every day and over many years, I must say?
Yeah, probably one of the most common would be what they can do, what supplements they can take, how can they help their liver, because the doctors, of course, just want them to go on the medical drugs, and there's a lot of people out there that don't want to do that. They want a healthy alternative, so like what can they do?
Yes, I think that is something that everybody thinks about. You know, will they go on the drugs or not? And that's a big question. Some people will be cured by drugs, some people won't be. But irrespective, you need to look after your liver. And, you know, Christine and I specialise in helping people to have a healthy liver. And the wonderful thing about the liver is it repairs itself.
Yes. And also I get people saying, well, can they take liver support supplements while they're doing the medical drugs as well?
Yes.
And I've also had people tell me that the ones that have done that they haven't had the same side effects that they've seen other people go through. Of course, you know, I can't make any guarantees on that. Everybody's different, but that's what I have been told.
Yes. Well, you know, I had one particular patient who had genotype 2 and was cured with drugs, but she said to me, the only way I got through this was by juicing.
Right.
It saved her life. She used to juice twice a day, drag herself out of bed and do the raw juicing twice a day. And that gave her the energy to keep going. So there's a lot of other things you can do along with the drugs to maintain a healthy liver. And you've got to do it for the rest of your life. That's the thing.
Yes.
You've got to be committed, don't you?
Yes, you do. And, you know, that's a big thing to a lot of people, but if they can really be helped if they do have that commitment.
Yes, it's just doing it every day. It's like brushing your teeth. It becomes
also,
a way of
you know,
life.
I think particularly with juicing and with myself, it takes 30 days or to make something a habit. So you really need to do it consistently for 30 days before it becomes a habit.
Yes.
And once it becomes a habit, you just get up every morning and you just do it.
Yes,
you know, so,
that's right.
yeah.
And Christine makes fantastic juices that are really liver healing. Tell us what you put in the juice.
Oh, I put so much stuff in mine, Dr. Cabot. I mean, you know, it's my own.
I know, I've
concoction.
tasted it. It's great.
Carrots, beets, celery, ginger, kale, spinach, beet tops, garlic, grapefruit,
citrus,
orange maybe, pineapple, apple, because sometimes I find with just vegetables you need something like an apple or pineapple or a citrus to kind of make it taste a little bit better.
Definitely. Yeah. And I say to people, look, 20% fruit, 80% vegetable.
Right.
And that way you're not getting too many carbs. And the other thing that's very important is not to have a fatty liver, because research has shown that if you have a fatty liver and hepatitis C virus, that those two things interact and make the inflammation in your liver much worse.
Right.
And inflammation leads to cirrhosis.
So, Dr. Cabot, what's another thing that they can do other than raw vegetable juicing to help with the inflammation in the liver?
Well, I think they need to have healthy fats in the diet.
Right.
A lot of people think, I better have a low-fat diet, but no, you want a low-sugar diet because sugar gets turned into fat in the liver if you have too much of it. And fatty liver's bad news if you've got hepatitis C. So healthy fats. So give us a few examples of healthy fats.
Avocados, fish oil, flaxseed, chia seeds, hemp seeds.
Yes.
Don't know, can you think of anything else?
No, that's good. That's a good summary. Oh, coconut.
Coconut,
Yeah, coconut, hemp seed, flaxseed, avocados. Very high in vitamin E. and vitamin E helps to reduce cirrhosis.
Right.
Yeah. What did Hippocrates say? Let food be thy medicine.
Yes.
And the other thing, there's some very good studies of selenium. Have a look. Do your own research. You know what Christine and I like to do, and indeed my whole team of people, we like to educate people so they can go and do their own research
Yes.
and feel confident. You really have to educate yourself. You don't have to panic. Look around, look at the studies. There's wonderful studies on nutritional medicine, and selenium has been shown in very well-designed, large clinical studies to reduce the risk of liver cancer.
Yes.
You can't afford to be low in selenium if you have any chronic infection, but particularly hepatitis C or B. You cannot afford to be low in selenium. So you can find selenium in Brazil nuts and certain foods, but I think it is good to take a supplement. Yeah.
Yes, because I think it depends too where the crops are growing, what the soil's like. Like a lot of soils are deficient in selenium today.
Yes, that's right. And vitamin D, very important.
Right.
Vitamin D makes your immune system stronger and has been shown to reduce cancer. Now, if you want more information, go to liverdoctor.com, and we've got a free ebook that you can download on how to keep your liver healthy and fight hepatitis naturally. It's a free ebook. I'm sure it'll help you. We've got a book called Raw Juices Can Save Your Life, and indeed they can. They saved my grandmother's life back in the 1930s, and they've actually probably saved Christine's life, having
Yes.
cured her of melanoma. So, you know, have a look. The resources are there on liverdoctor.com, and even if you have got a hepatitis infection, you can have a long, healthy life. We have many patients who are doing very, very well and have improved their liver function. And we should mention alcohol.
Yes. So, what's your thoughts on alcohol if people have hepatitis or a chronic
Yes.
viral infection, Dr. Cabot?
Well, I think control it. You know, you shouldn't really have more than one standard drink a day. So that would be 7 or 8 drinks over a week. And I always remember one of my patients who had hepatitis was a very well-known, successful business person and a lawyer,
Yes.
and came to see me from a long way away because he had cirrhosis. Why did he have cirrhosis? Because he used to smoke, drink too much alcohol and drink too much coffee because he was totally dedicated to making money. What's the point? You end up with cirrhosis, and he was only around 60. So what you need to do is realise the liver is the organ of longevity. If you want a long, healthy life, you have to take care of your liver. You have to have a good diet and lifestyle, and, you know, look at not being deficient in selenium, vitamin D, and other antioxidants to reduce inflammation. Yeah. So love your liver and live longer, everyone, and it was great to share this wisdom with you today.